What do you see as the most pressing challenge facing healthcare today, and what are some of the technologies that are best positioned to address those challenges?
Really, I think that the biggest challenge is how do you deliver personalized medicine? So it's personalized medicine, but both from the consumer experience as well as from the clinical experience. That is truly the ideal, and that's truly the holy grail of where we all want to be.
I think that this pandemic has changed patient receptivity to accessing care virtually or having remote monitoring, and it certainly has accelerated provider or physician receptivity as well. Hello and welcome to the Permanente Medicine Podcast. I'm Chris Grant, your host and Chief Operating Officer of the Permanente Federation. In today's podcast episode, we're taking a look at the health IT space and examining the digital transformation that's happening in healthcare. Our guest is an expert in this area, leading work for one of the most prominent cloud-based software companies. Joining the show today is Dr. Geeta Nayyar, Senior Vice President and Chief Medical Officer for Salesforce. In her role, she connects North American health systems to technology that empower hospitals, enhance the work of physicians, and improve patient care. An internal medicine physician specializing in rheumatology, she has received a number of industry accolades, including being named to Health Information and Management Systems Society's Most Influential Women in IT, Fierce Healthcare's Women of Influence Award, and Becker's Hospital Review Movers and Shakers list. Thanks for joining the podcast, Dr. Nayyar. It's a pleasure to have someone with such an illustrious background on the show.
Thanks so much for having me, Chris. I really appreciate it.
All right, well, let's have some fun and get started. I'd like to start by getting to know a little bit more about your path to leadership. You've held several impressive positions as a health and technology leader on your way to joining Salesforce. When you look back, what were some of the most pivotal moments on your career journey to getting to where you are now?
Gosh, there's so many, but I would say that the ultimate path here was happenstance, right? It was good intention, hard work, a lot of mentors, and some good old-fashioned luck, I think, at the end of the day. But I remember really early on in my medical career being so determined to become a rheumatologist, so determined to be the attending that was just really owning patient care and owning decisions. And really early on in my training, I realized that physicians actually didn't own a lot of care, right? It was often the administrator, the nursing administrator of the hospital, the payer, legal. There were all these other stakeholders that you just don't realize as a naive medical student. And what I realized as I was going through my training was, if I did an MBA, if I could understand the language of business, if I could understand what all of these people are talking about, because I only spoke the language of clinical medicine. I felt I would be that much more impactful to really bring the front lines of care to the back end of care. And my technology journey really was just an accident. I was in training at the time that George Washington was rolling out Allscripts. It was one of the first Allscripts sites. And I realized very quickly also, gosh, this tech thing is going to be the future of medicine. But gosh, they're doing it all backwards and wrong, and they don't understand the workflow, and they haven't asked any of us what we're trying to do when we write a note and how we bill. And the rest is really history. I mean, it really just started as someone who remains and was very passionate about clinical medicine and driving outcomes, and just saw so many dysfunctions along the way, and said, how could I change that? How could I move the needle for the industry?
That makes a ton of sense, and it is so true that frontline operations really need to define the requirements for technology and to provide that critical feedback to those that are developing the technology on how it needs to work, how it needs to flow. So you shifted from clinical practice into the business and technology sector. Tell me a little bit about how you navigated that shift.
So again, everyone thought I was nuts. All my other fellows, all my other folks I had trained with, doctors in training, because I made the leap early on in my career. They said, you could be on a partnership track in a private practice. You could go into academics. What is the heck are you doing, right? At one point, my dad said to me, So we helped you with medical school, to pay for medical school so you could work for the phone company, because I was the chief medical officer of AT&T. And so it didn't make a lot of sense. It certainly did not make a lot of sense to my colleagues, and it was a little bit of a risk. And I would say that the first jump that I made into the consulting world was really rough. I had no idea about business etiquette. I had no idea how to use a calendar or even send email. That was just not part of our everyday work and our training, right? It was all about the chart and the EHR and your beeper. Remember those things? And so it really was a rude awakening. And I would say I had some terrific mentors, both female and male. But it was tough. I remember distinctly sending a note to our CEO at the time for the company I was working for, and some big deal, some big thing. I was, wanting to send this email, and I was so used to doing shorthand in the charts that I said, da 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 da, and I will F you later, right? Follow up, right? I will follow up with you later. Like, obviously that's what it was,
Yeah,
right?
of
And my
course.
boss immediately got a phone call from my boss. What did you just send? And she CC'd us. And I said, well, and I tried to be funny. I was like, at least I didn't call him an SOB, right? Shortness of breath. And so there were so many little mistakes that you don't even think about when you are transitioning. But the business world and the hospital world are entirely different, and they remain entirely different. So it was a rough ride. And at many points, I thought to myself, I have made the wrong decision, and it was scary. I felt I was young enough to take the risk and to see what would happen.
Wow, that's terrific. And it does point out the need to have navigators, right? From the clinical to the business world, because the business world and the technology world is so essential to healthcare. But it's also a complicated industry of both clinical science and regulatory and different payer kind of needs and requirements, that having folks that can transcend from both clinical to business and be interpreters of those needs and those requirements is so essential. So we talked a little bit about the past, and I'm going to kind of get us delving into the future. Now, the last couple of years have obviously been filled with tremendous challenges in healthcare, but there has also been some incredible advancements in vaccines around COVID-19 that were just breakthrough science in rapid time. The acceleration of telemedicine, remote patient monitoring, and so much more. What excites you the most about these innovations, and how do you see them improving patient care?
Look, I think every one of us in the industry appreciates that the mother of necessity, right? The invention. I'm going to mess up this adage, but necessity is the mother of invention, right? And we've seen that happen in the past 2 years. We knew telemedicine was a good idea. We knew customer experience was a good idea. We knew informing patients and engaging patients and making sure they're educated on healthcare decisions was always a good idea. And we knew we needed analytics. It's just that we were able to accelerate the path of innovation so quickly because COVID made it so necessary. You were not able to go into the hospital. So what were you going to do? Virtual care. You were not able to, there was no bandwidth. So what were you going to use? You're going to use chatbots. You're going to use texting. It's exciting, but it has also exposed all the dysfunctional pieces of the healthcare system. And so the question we really have to be asking now is, if you are a hospital system, and I actually believe every CEO is asking themselves about what is their healthcare strategy, independent of whether they're a hospital system. But it's really, how does this never happen to my business again? That's really the question, because this entire pandemic really put us on our knees. And so the question you have to be asking yourself is, how do I bolster my infrastructure, both clicks and bricks, right? Because we still need that brick and mortar system, but we also need that virtual environment. How do you integrate those in a way that is seamless, both to the patient, and yes, the physicians and nurses count too. We have realized that burnout is a real thing. Staff shortages couldn't be higher, and morale and culture are important, right? Technology is only going to be a part of this equation. People, process, and culture are equally important, and really are going to lead down the road to success. But I'm really excited to see that we have proven that we can do it, but I think we can do it much better. So much of what we did in the investments we made were very reactionary, right? COVID was supposed to be here and then go away. And we saw that happen 10 times, right? Kept coming back.
Right.
And so now is the time to still be cautiously optimistic. and say, well, for, whether it's COVID, whether it's the next pandemic, whether it's just everyday life in the hospital, I want my staff to be happy. They will stay with me. The customer expectation now is such that they expect X from me, and I want my patients to be happy. And so that's really, I think, the opportunity here, and we'll see what the industry does, but that's the biggest opportunity here, is not to go back to where we were. We can do so much better, and we've clearly seen that needle move.
Boy, that's so true. And you know, that really is a perfect segue to my next question. You know, technology has helped us overcome many hurdles in the field of medicine, in particular over the last several years. But an increasingly virtual environment also has created some issues for both patients and physicians. You and I are digital natives. We've grown up with information technology, but that's not the case for all practitioners in healthcare. What do you see as the most pressing challenge facing healthcare today, and what are some of the technologies that are best positioned to address those challenges?
You know, really, I think that the biggest challenge is, how do you deliver personalized medicine, both from the physician lens, where you can say, you know, for me as a rheumatologist, hey, Dr. G, this is a 55-year-old African-American female. So for her particular genetic makeup, this is going to be the standard of care for her lupus, right? So doctors very, very excited, right? As opposed to limited studies, limited information,
Right.
Studies that don't have enough, a variety of patient population, et cetera. And then for the customer, for the consumer, the patient, is to be able to say, hi, Mrs. Jones, we actually know who you are, and we understand your social determinants of health. We understand your kidney function. So for you, this is not just the personalized medical treatment from a diagnostic and treatment standpoint, but also from an experience standpoint. Do you need a ride? We know you need a ride. So we've set that up for you. And we also know the best day that you're off of work is on Thursday, and et cetera, right? So it's personalized medicine, but both from the consumer experience as well as from the clinical experience. That is truly the ideal, and that's truly the holy grail of where we all want to be. Do I think we're going to get there anytime soon? Unfortunately, no, but I think we continue to make strides, and I think certainly AI technologies will be a big part of that. I also think consumer technologies, right? Remember, the EHR revolution that we have been a part of, those are clinical-facing systems. They were built for the doctors and the nurses and the care team, and actually not built very well, as we know, right? And we've seen in the industry, because largely of a regulatory environment as opposed to actual demand in a normal business ecosystem. So that's why the end users were really left out of all of that. But now we realize that so many systems have invested in legacy systems that were not built for 2022. They were not built for a quote post-pandemic world. They were not built for a consumer experience. They were not built with the Amazon experience in mind, right? And so it's important that the industry look to new technologies and look at other industries. The financial industry, right, you can argue, has had many of the same challenges around privacy, security. And yet I don't know the last time I went to a bank, Chris, right?
Right.
So other industries have done it, and other technologies have done it with also legacy system issues, legacy process and culture, but it is very doable. And it's finally the right time for healthcare to say, you know what, maybe we're not so special, and we should take a couple of playbooks from retail, travel, hospitality, financial. This is all very solvable, and I think we've finally come to the place where it's the perfect storm of all the stakeholders aligning around, this is good for the business, good to drive revenues, as well as actually the right thing to do, right? So it's been an interesting journey, certainly.
Yeah, you're so spot on, and you know, I think that this pandemic has changed patient receptivity to accessing care virtually or having remote monitoring, and it certainly has accelerated provider or physician receptivity as well. I love your comments about knowing the patient and just being deeply personalized, because we tend to think about the science part of medicine, but so much of the science is linked to the individual. You've done a lot of work around looking at how physicians can use electronic health records to create more efficient ways of working, which can help prevent burnout You talked about the current burnout that exists, not just across doctors, but I think all healthcare providers that have been working incredibly hard through the pandemic. Kaiser Permanente, for its part, is the largest private electronic health record system in the world, helping our Permanente medical groups provide high-quality care. What have you learned about how we can harness the power of that health record to help ease the burden on clinicians?
So the first thing is including physicians in the recipe making, in the cooking, in the strategy, in the execution, right? It's really involving the end users, and it's the care team, right? It's the doctor workflow, it's the nurse team workflow.
Right.
It's so basic and fundamental, but it is the best way when we think about change management and processes and culture. I mean, the fact that the EHR industry, I mean, every doctor knows this, my clinic included, I still see patients. There are like 6 best practice workflows for every clinic, every specialty, and we all share them like, oh, to do that, you have to, this is the workaround. If your technology is built on the end user making workarounds, that says it all. It means we are working around the workflow that the EHR built to actually do the job that we need to today for our patients. And every physician, every nurse has experienced that. It doesn't matter what EHR system. And so if we look at where we are in history and if we look at where we want to go, the opportunity here is to really engage the end user, starting with the problem that needs to be solved, right? I believe in the KISS methodology, right? Keep it simple, Sally.
Right.
And doctors are highly intelligent people. They will use technology if it works and adds value to them. If it does not, they will not. I mean, that's your whole change management consult right there, right? It's very basic. So you really want to include them if you are purchasing vendors, if you are making changes. What is your strategy? What is the goal? What is the job to be done by the clinical team that this technology is supposed to be solving? And really ensuring that that clinical leadership is involved from soup to nuts, and not just to have them at the table, but to actually listen to them and give them decision-making authority to say yes, no, maybe. Now, as we look at where physician burnout really is in the industry, it's how does the technology truly serve the clinical team and even not have to interface with it? Even better, if they don't have to learn something new. And
Right.
it just gets done for them invisibly, right? That's really where the future will make the biggest impact on the workforce in health tech.
I think that's right. I think it is the ability to help a physician or a nurse navigate, more seamlessly and be able to provide more time in front of a patient because they have to spend less time charting, or help think about a patient's needs 7/24, even when the clinical team might be home sleeping at night, but we're using technology to continue to provide monitoring or other aspects of care kind of seamlessly behind the scenes. As technology becomes more integrated in medicine, there is a concerted effort across Kaiser Permanente and other healthcare organizations to bridge what's often referred to as a digital divide that makes it challenging for some socioeconomic groups to access the care they need. I know one of your personal passions, Dr. G, is helping underserved populations receive care. And I've been so impressed by Salesforce and at the senior-most CEO levels commitment to equity, diversity, inclusion. It's a shared value that we hold together in Kaiser Permanente and at Salesforce. What needs to be done on this front to help ensure as many people as possible get high quality care?
Well, Chris, thank you for that. We really do take it very seriously in everything that we do at Salesforce. And as I think about what it means in the healthcare environment, look, I see patients at the Center for Haitian Studies at the University of Miami, and it is really humbling the situations that so many patients find themselves in that affect their health, right? Simple things like transportation, health literacy, language, religion, these all impact health. And that's what we are finding, right? But what the healthcare system is not even set up to do is to even ask the questions around social determinants of health. Do you have transportation? Do you speak English? What language do you speak? right? What is your diet? Because you have to understand what truly are those social determinants of health, and then how do you action them? One of the biggest issues for our diabetic patients is just getting to dialysis. You miss one dialysis, two dialysis, you buy yourself an ER visit and maybe an ICU visit and possibly a mortality. That can all be solved with a bus ride, an Uber ride, a taxi voucher, right? So these are the things that the healthcare system really needs to work on. And the other part is simply trust. There's so many minority communities, and we've seen it with COVID, right, that were hit the hardest, and they just did not trust the medical community. And why is that, right? There's a lot of history there. And so how do we turn the corner on that and also recognize that the messenger counts? Communities like to hear the message from other individuals that look like themselves. We all do. We all feel a more kindred spirit when we are connecting with someone that looks like us, talks like us, eats like us, walks like us. And it is okay for the healthcare industry not just to acknowledge that, but to embrace that.
It really is about meeting people where they are and in a way that makes them the most comfortable. Digital resources make it easier than ever for people to access health information online. This can be a double-edged sword depending on whether or not that information is credible. As a frequent contributor to several news outlets, and I've seen you on just about every one of the networks, what are some steps that you believe we can take to curb misinformation around healthcare and technology?
Well, I think the first thing is acknowledging that we have a problem, right? We do not have a health literate population, nor do we do any sort of health literacy education. It's really not something that's been done. I would argue that both health literacy and financial literacy are important and often go hand in hand. And even that is not, there's not a consensus around that, right? And a lot of what we just talked about, which is the messenger counts, right? And realizing that part of this is, look, it is much easier and cooler to understand a video on TikTok with like the coolest athlete, the coolest rock star, whatever it might be. I like watching those videos. They're really fun, right? But I know if what they're saying is true or not. The average consumer does not. And the truth is, it is easier and more relatable to ask your hairdresser, your neighbor, right? And that's what has happened in this era of misinformation and disinformation that we're living in. And so it's really time for hospitals, providers, regulators to say, what is the role of public health in informing people? And how do we do it in a really meaningful way to actually use technology to help us? Whether that's a marketing campaign put to use by technologies of a hospital, whether that's social media. I think there are ways to do this that can really move the needle, but it starts with what we talked about, which is trust. Who is the audience? The audience and the messenger should match, and the roles and responsibility, right? And where does that begin and end? But really owning that and taking that, because hospitals have traditionally thought of that as marketing and kind of as a nice to have as opposed to a must have. But I would say that that's part of your patient acquisition and retention strategy. If my doctor sent me good health information all the time, it's flu season. Hey, this is what you should know about the flu, or here's the 3 things you should know. You're pregnant. Here's the information you need to know. Why would I go to TikTok? Why would I go to my neighbor or my mechanic? Because there's that gap. Other stakeholders have filled those largely with their own motivations. Right, to sell something, to whatever the motivation might be. I still fundamentally believe that people trust their doctors, but they don't have access to their doctors. They have less access given all the shortages that we have today, and they also are just not traditionally using the voice of the physician to communicate a lot of these things, and that really has to change. And as I think about the role of our Surgeon General now, I mean, we need a Surgeon General in every zip code. Right? Because so much of healthcare is local and the doc has patient population. So why is part of that mandate or part of the way the hospital empowers docs is not also having that big megaphone to really make the truth so easy to access so that there's no way you could be confused?
I love that concept of having a Surgeon General in every community that looks like, feels like, sounds like me, right? Or represents kind of the societal aspects that I feel part of. One of the things that we've done within Kaiser Permanente is we've gone to churches and even to beauty parlors where people frequent, and we've worked with the clergy leadership or the stylists in order to impart helpful medical information to that community so that they could then be the conduit to their constituency, to folks that trust them with accurate information that's helpful. It's clear that innovation in technology will play a pivotal role in how patients receive care moving forward. As we look ahead, what other industry trends are on your mind that we haven't covered today in this conversation?
So, I think we did cover a lot of it. And as I think about the work we've done here at Salesforce, right, we've digitally transformed every industry: retail, manufacturing, travel, hospitality, fintech. So again, I think these are issues that can be solved. And the way that I think hospital systems have to think about it is with an outside in approach, right? You want to be the Ritz-Carlton of the hospital experience, right? There is no healthcare brand that I can think of that, that I want to aspire to be, because so much of every healthcare experience has some friction, right? And to truly think about taking the friction out, you actually do need, those brands are reminiscent of no friction. The Ritz-Carlton, a Disney-like experience. They know exactly who you are. They know when your birthday is. They know that you don't like chocolate, right? These
Right.
are the things. And you walk away delighted. And that's ultimately the customer experience that everyone should have, rather than so many of the healthcare experiences that we know happen daily. And so much of the healthcare experience for patients is like, you're lucky to be served, right? Like you're lucky to be here, not the other way around. And so I
Right.
think that has to change. And as we look at the retailization of healthcare, as we look at the CVS, Walgreens, and Walmarts, a big part of that is access. The retailization of healthcare is flipping the paradigm of access, because so much of what people want is access to a doctor for a conversation about a question. Physical exams aside and interventions and procedures aside, people are really thirsty for access and for knowledge.
Yeah, it's such great points, and you're right. And we have information, we have technology now that we can customize care and know what a patient likes, what they don't like, how they access care on a regular basis. At Kaiser Permanente, this last year, we implemented program-wide across all the states that we operate in, access to care that we call Get Care Now, where a patient can access via video, via text, via phone call, or can schedule an appointment. And if they want, they can be seen within a matter of just a couple of minutes, directly connected to a doctor. And it really is about that consumerization of healthcare and making it that we will meet you wherever, whenever, however is most convenient to you. Hey, I want to wrap up with a last fun question. So there's so many great diverse voices right now in healthcare and technology space, you being one of the leading. What are some of your favorite people to follow, and what do you do to keep up with the layest trends?
Oh my goodness. Well, I listen to your podcast, first of all, Chris, so I'm going to make a shameless
Thank
plug.
you.
I read all kinds of stuff. I mean, I love reading the Becker stuff. I love reading the Stat News stuff. I read JAMA regularly. I read consumer news on Thrive regularly. And I follow all the top thought leaders that probably all of us do, from Eric Topol to Ashish Jha, to some of the media doctors out there like Sanjay Gupta, Leanna Wen. And honestly, I listen even more now to my neighbors, my friends, the moms at the school, because my experience is different, and we've drunk the Kool-Aid, you and I, right? But I have really tried to challenge myself to listen to the end user in this experience over the past 2 years, and how they have experienced this.
I have truly enjoyed this conversation, and you've been just such a fantastic guest. The work you're doing is literally transforming the way we practice medicine, and I can tell that you are going to be a major force in defining how care is delivered. I'm looking forward to seeing what you're doing in the years ahead. So thanks for joining me and for taking time to share your wonderful insights.
Thanks so much, Chris. Thanks for having me.
And thanks again to all of our listeners for tuning in. I'm Chris Grant, and we'll see you next time. The opinions expressed on this podcast are those of the speakers and are not necessarily the views of Kaiser Permanente, the Permanente Medical Groups, or the Permanente Federation.